give you the best of live streaming across all states in the US. We also do web designing, event planning, MCing, app creating, and promotions. Or if you want to shoot an advert for your business or a show, you can contact us on +1 773 312 0318. For more information, you can visit our website at www.trendafricaonline.net and also on our social media platforms at Trend Africa TV. You can download our app Trend Africa Online on the Google Play Store and App Store. Trend Africa, redefining Africa.
Are you sick or have a health emergency and don't want to wait in long queues at a hospital, especially during these times of COVID-19? Worry no more. Dr. Now GH will bring the hospital to you. Now at your fingertips, you can see a doctor of your choice. Simply download the Dr. Now GH app from your phone's app store. Don't wait. Hurry now to sign up for free. Dr. Now GH, your doctor is now at your fingertips.
My name is Eunice Cromwell and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Welcome to another exciting episode of Health Talks. My name is Dr. Araba and I am your host, a family nurse practitioner. Today, we will continue our segment on healthcare in Ghana, but we will be speaking to someone who provides healthcare delivery in Ghana. I'd like to give us a few minutes to share this link with our family and friends and make sure that everyone is going to be joining us for this very important episode. One moment and we'll be right back. Thank you.
Hi, my name is Ochiame Kwame, the rap doctor, and I have something to tell you. When you need a doctor, you mustn't go anywhere. All you have to do is to call Mobile Doctor. They will send a doctor to your home, send a flap to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD and they will give you an amazing discount. Mobile Doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net. Mobile Doctors, the doctors in your home.
Royal Black says we are back, maka maka. Entertainment and sports, maka maka. I say politics, maka maka. Royal Black says, Assembly Safwa, yeah, Assembly Puno, Sane Pia de Kami, Ekome Yakotofumi, Ekome Yami Sebe, you want love make a hanging, maka maka. Royal Black says we are back, maka maka. All the trending issues, maka maka. I say politics, maka maka. Entertainment and sports, maka maka. RBJ Diaba, where you full from crowd. Asami Safwa, yeah, Asami Puno. Sasemi Ba, yeah, Becca. Sanya Betino, Sabape na Yabekano. Maka maka, Akasame Kwetewo. What by you no ni one na jeno na ke. What by you no ni one na jeno na ke. Say a politics RBJ Becca, or Becca, a sports RBJ Becca, or Becca, entertainment swear RBJ Becca, or Becca, trending issues RBJ Becca, or Becca. Maka maka, yeah, Diabao, Becca.
Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for tuning in, and let me go ahead and welcome all who have just joined us. Health centers in Ghana play an essential role to healthcare delivery, especially in deprived communities. They usually serve as first line of services and meet basic healthcare needs. Unfortunately, these facilities are faced with inadequate resources. While healthcare policymakers seek to increase resources committed to primary healthcare, it is crucial for us to understand the nature of insufficiencies that exist in these facilities. This means that private medical companies must access high quality private facilities to receive evidence based medicine. Today, we have a gentleman that's going to be joining us, and he's going to be talking to us about healthcare delivery. Let me go ahead and introduce our guest. He is none other than Mr. Patrick ANNAN-NOONOO. Mr. Patrick ANNAN-NOONOO is a healthcare management expert and founder of ExpressMed Healthcare, a convenient and digital healthcare provider in Ghana. He is also a senior medical records officer at Ghana Cocoa Board. Patrick is consistently embarking in preventative health campaigns across Africa, notably COVID-19 prevention, HIV/AIDS sensitization in Cote d'Ivoire, malaria and cholera prevention in Nigeria, sanitation and teenage pregnancy prevention in Ghana. In addition, over the past 5 years, he has specialized in facilitating foreign companies such as Hex GN to build partnerships in Ghana and Africa. Patrick is a member of the Chartered Institute of Marketing, UK. He holds an executive MBA in project management at the University of Ghana and a bachelor's in business and management at the University of Cape Coast. He was the former curator of Cape Coast Hub, part of a global shapers community, an initiative of the World Economic Forum, and he was also the former director of external relations and marketing for AIESEC Alumni Ghana. We are very privileged to have him joining us all the way from Ghana this evening. Mr. Patrick, you are welcome to the program. How are you?
Thank you very much, Doctor. I'm doing great. It's an honor to be here. Just before you start, I might say that you are doing a great job. I followed some of your works and especially your contribution towards the local communities in here in Ghana. And you inspire a lot of people and a lot of women out there. So you should keep it up. You're doing a great job.
Thank you. Thank you so much. God bless you. Thank you. We are very excited to have him here. So let's go ahead and dig right in. So
Sure.
just to get a little, let's just get to know him a little bit better. Then we'll hear about your company. So tell us a little bit about your role as a senior medical records officer at the Ghana Cocoa Board.
Yes, Doc. So with my work at Cocoa Board as a senior medical records officer, it has to do with collecting the right patient information and then processing it for doctor consultation and then for payment by the health authorities. However, over the years, we've gone beyond just processing to now analyzing the patient data to enhance healthcare delivery. So once you analyze the data that we collect over the period on a monthly basis, we're able to make recommendations to senior management. And out of that, they're able to improve on their services. So for example, they're able to add specialist services that people request the most. We're able to see the trending health issues over a period of time and then make the various decisions that we need to improve the healthcare just for the local community.
Oh, I understand. So does the Ghana Cocoa Board, do they have their own physicians or do they see their own specialists? Is that what you help coordinate?
No, so Ghana Cocoa Board has a hospital,
Okay.
has its own hospital in several regions in Ghana.
I see.
Yeah, so I'm based in the hospital in Accra.
I see.
Yeah, and then we have our own specialist physicians, we have our own doctors, we have our own staff. and then we have our management. And so we help coordinate all these. Yeah.
Oh, I see. Oh, wow. That's very interesting. You also
Yeah.
mentioned, it was mentioned in your bio that you do some preventative health campaigns. Tell us a little bit about
Mhm.
the one you were doing in Cote d'Ivoire. That's very interesting about the HIV and AIDS.
Yes, so some few years back, HIV/AIDS was taking root in Africa, and then Cote d'Ivoire started recording some numbers.
Okay.
And so, in partnership with ISEC, AIESEC, we had to work with people from different countries, I think about 15 countries. And so if we had a team assigned to Cote d'Ivoire. So what we did is we targeted two main segments: students and then rural communities. So we did a door-to-door campaign, and then we did a community outreach to understand why the increase in HIV is one from the policy or from the authorities' point of view, but also in the homes we sought to educate them on how to prevent HIV/AIDS, the use of condom, prevention, abstinence, and then for the students, we try to engage them to understand why somebody might get infected and what happens even after that. And you get interesting feedback about misconceptions and all that. So it was an exciting experience going to Cote d'Ivoire to work on HIV/AIDS. Yeah.
Oh, wow. And also, it was mentioned that you did some malaria and cholera prevention in Nigeria. Tell us a little bit about that.
Yes, so what we were doing over the period was to tackle some of the prevalent health conditions in Africa,
Okay.
and then we tailor it. So in Nigeria, similar to Ghana, we realized that over within a certain month in the year, cholera spreads more, it increases, and so we decided to take a proactive approach where we go there months before the cholera outbreak to educate them. And so you realize that even though we know that you have to wash your hands with soap and water, some people actually believe that you wash your hands with soap and water after eating, not before. These are little things that people do that they do not know that it can lead to that. So we sought to, and we go with a specialist as well. So we go with somebody in the field of maybe cholera, or a doctor or a physician who can also help educate and then show them a few tips on how to prevent cholera and what to do if you start to feel any of the symptoms. And so we did, we went to University of Lagos, Unilag, and then where we did that campaign for the students. Yeah.
Wow, that's excellent. And then lastly, teenage pregnancy prevention in Ghana, which I know is a big one, even especially around the rural areas. So tell me a little bit about that teenage pregnancy prevention.
Yes, teenage pregnancy was on the ascendancy. Here in Ghana, it's been between the central region, sometimes eastern, sometimes the Volta region. So we went to the central region at the time. And in the rural community, we have adolescents,
Mhm.
14,000, recording over 14,000 pregnancies in a year. We didn't understand it because central region has one of the, a lot of schools. It
Right.
has a cluster of schools, and the best secondary schools, majority of them are in central. So we thought education wasn't a problem. So we had to dig deep, form a team, and then go there to understand things for ourselves. And it was revealing, when we interacted with the young people, some of the victims, they tell you that, well, it's the young guys, the teachers, the fishermen, the fisher folks, the neighbors in the hood who get them pregnant, and sometimes they do not take responsibility for it. So what we sought to do was it was a serious project because they were not privy to most of the information. It had become normal, you
Hmm.
know. Yeah, and so we had to do a lot of sensitization, a lot of counseling, form groups, focus groups, and then do frequent interaction together with the local authorities, so like the chiefs or the assemblymen, because they had to feel that we are part of them. So we had to frequent the place a lot, and then take them through a period, of monitoring, evaluation, uh, central teenage pregnant, and make sure.
Right, right. Wow, very, very interesting. So that was more focused on the central region of Ghana. And so do you guys have like a follow-up program where you're able to see if some of the things that you put into place, are they working? Has there been a reduction in teenage pregnancy in the central region of Ghana, or is it still a pretty major issue?
Okay, so we still have recorded cases, so it means the work isn't done. However, there's been a reduction. So 2019, 2020, Central region wasn't the leading region. It had reduced. Okay. However, the monitoring has also reduced, and so that's where we need to put in a lot of effort. We had a focus group, selected about 50 people, 50 young adolescents, and taking them through education. So we're doing a comparative study between educating the young girl, and then also leaving her to hustle or fend for themselves, and then compare the disparities. And so we do monitoring, but it's not as frequent as we used to, and that's where we need to probably focus more effort on.
Absolutely. That's wonderful. So we're going to go ahead and get a little bit into your company. We can see from your introduction and all the things that you have explained to us that you are very compassionate about healthcare. So it's not surprising that you went ahead and started a company, ExpressMed Healthcare. So tell us a little bit about what ExpressMed Healthcare is.
Okay, so ExpressMed Healthcare is a preventive and a digital healthcare company focused mainly on the 3 tiers of preventive medicine: prevention, early detection, and then management. So we realized that, I saw some challenges in the healthcare sector, working in both the private, I worked in both the private and the quasi-government or the public hospital. So I got a hindsight of some of the challenges. So I followed up with some research with the doctors, research with the patient, and I realized that some of these challenges could be addressed easily. For example, long queues, you have patients spending more time in the hospital, but shorter time with a doctor.
Mm.
Okay, and it was normal. And some of reviews and stuff like that, I thought that could be done at home. So ExpressMed isn't a competitor to hospitals. No, we rather complement the services provided by the hospitals. And so on these 3 tiers of preventive medicine, one is prevention, where we do a lot of advocacy, and that's what we use most of our digital platforms for, and then the community outreach. So we do a lot of sensitization, a lot of advocacy, a lot of education on healthy lifestyle. Then the next level is early detection. I watched some of your videos with Dr. OFORI and then Sam from Fleury, and they were speaking in that line. You realize that medical screening is not something that is common here. They are not used to. They want to fall sick before they go to the hospital, but that's something that could be avoided if only we do periodic medical checks, because prevention is now better than cure. And so we encourage those in the working class to do a lot of medical screening, and sometimes they see results that they thought, they never knew they had this underlying condition.
Great.
And you realize that when COVID-19 hit, those with underlying conditions suffered the most. And some of these people didn't even know. And so that's what we do with the early detection. And then the last stage is management. Unfortunately, for those who detect it late, we still have to manage it so that it doesn't get too serious. And so we have some of the aged in this category. And then we provide home care services for them to constantly monitor and manage their chronic diseases so that it doesn't deteriorate, but rather they should get better. Yeah.
Absolutely. And I took a look at your website and it's quite impressive. You have people who go out to people's homes and you're able to check blood pressures and check blood sugars. Would you say that the population that you're taking care of, do most of them suffer from hypertension and diabetes? Is that what you're seeing more often of?
Yeah. Unfortunately, majority of our clients fall in that region.
Okay.
They fall in that category. Non-communicable diseases, hypertension, stroke, diabetes. Some late detection, some as a result of they not frequenting, they not taking healthcare too serious. And so that prompted the home care services. Some are bedridden. They can't go to the hospital. And so we have a whole medical team to go there periodically to provide them with quality healthcare. And they are doing great. They like it. Yeah.
Very important. I like the fact that you talked about bedridden because I think when people hear companies like this, they think about people who have the money, people who want the luxury of just having a provider come to your home. And we sometimes forget about the people who physically cannot leave the house. And those are the ones, to me, that are more important that need a physician to be able to come to the home. So, very, very good that you guys are able to provide that service. Now, tell me, I'm
Thank
looking
you.
at your background and I see that you have a degree in business management and all these other things. So then what prompted you to enter the health sector and what prompted you to start Express Med?
I know. I know it's been it's been all business from day one until I worked in the healthcare sector.
Okay.
So I was the administrator for a private hospital in an urban region here in Ghana. The
Okay.
healthcare practice is different. The patient the appointments, they come in, they are booked. Everything was seamless. But then I had a lot of complaints being the administrator. So a lot of customer service had to go on. And then we always jot down the challenges that I addressed with the doctors. And some of these issues kept repeating that we tried addressing. However, due to inadequate physicians in the country, you cannot have a doctor in the hospital and also enough doctors to go to the homes or offices of patients. Because the doctors are not enough already. Same with laboratory, same with nurses and the other stuff. In the public sector, it's different. Because of NHIS, National Health Insurance, we have majority of the populace trooping into the public sector, and this puts pressure on the resources. Yeah, and so a doctor can only see so many people at a time. And that kind of affects the time and the comprehensive assessment that you can give to a patient.
Absolutely.
And so some of the patients would really want to have more time, we really want to express themselves, but they cannot get that opportunity. And so in our research, so when I found this, I discussed it with a few doctors, on how we can address this. And then we came up with a solution. Initially, it wasn't about even prevention. It was about home care, so that we don't have a lot of people coming to the hospital. And then we realized that in providing the home care service, there is an underlying, a more critical situation, which is prevention. We're not taking preventive healthcare serious. So we realized that if we had a more healthier workforce, a more healthier nation, illnesses will reduce, frequenting the hospital will reduce, we'll have a more productive economy. And so we took this approach. And so coming from the business background, we now had to look at providing quality healthcare, but also sustaining the business. And so that is where my knowledge and expertise from project and the management and marketing also came in, together with the expertise from the doctors and then that of technology. So we combine these to deliver quality healthcare at the patient's convenience. So what we really hammer on is convenience. Yeah.
Convenience. Very, very important. And so we saw that you have a few digital platforms. You have the app, you have the wearables, and the short code. Could you go ahead and just let our viewers know what exactly those delivery systems do, those digital platforms?
Okay, so let's start with a short code.
Okay.
Let's start with the short code. I was happy you mentioned that it's not always about, when people hear home care or preventive medicine, they think it's for the high income earners, but that's not it. Yeah, that's not. Healthcare should be accessible to all, and that's what universal health coverage seems to hammer on, and that's the channel that we are using. And so for the short code, we designed it for those with feature phones, those who do not have smartphones but will still need healthcare. We also designed it, it's a low cost model. All you have to do is to just use a short code, and then you can just type in your issue or make a request, and then we have a health expert reach out to you and then talk to you on phone to discuss the issue. So after discussing with you, then we can now assign you to a doctor to come home, see you, or you meet, or we assign you to the nearest hospital.
I see.
Yeah. And then for the wearables, the wearable is on demand for the corporate bodies.
Okay.
So one of the services that we provide is corporate wellness. We have really brought corporate wellness programs to Ghana, and they love it. And so we were trying to get workers engaged. Getting the solution is one, but having people adapt and use it is another challenge. And so we sought to add gamification to our solutions. So we're encouraging the workers to, if you have a wearable, say a smartwatch, then we program it so that we can monitor your physical activity, especially simple things like your walking steps in a day, sitting posture, physical activities that you've had in a day. Then we compare it to your other colleagues in the office. So it was fun for them. Oh. So at the end of the day, they're able to say, well, I walked 1,000 steps, you didn't, so I won, or maybe I get free lunch tomorrow. So that's why we designed the wearables. But you realize that some of these digital platforms are disjointed, they are in silos. If we can put all these under one platform, like an app, to be easy to monitor, analyze, and improve healthcare. But however, developing an app also takes time. It takes a lot of piloting and testing. So we've gone through about 2 rounds of piloting, and we are still developing that.
So you're still working on the development of the app. So tell me, the wearables, are these things that people already have and you program it, or do they purchase it from your company?
It's 2 ways. So far, for one multinational company that we went to, they had it.
Okay.
They had it, so it was easy to monitor. But for others who do not have, they let us know, and then we program it for them. We customize it for them.
Okay. So they purchase it from
so it's
you
not something that we
program it.
Yes.
Okay.
Yes.
Okay. Very, very good. And so we know that your services, and you spoke a little bit about this, you talked about the home care. If we look on your website, and my producer has put your website up along with your Instagram and your Facebook. So make sure everyone who wants to get this service for your people back home, make sure that you follow him on Instagram, on Facebook, and then his website has also been displayed there. Now we look at your website and we see that you guys offer consultations, home visits, telehealth. You talked explicitly about the corporate wellness, which is an excellent idea, and then nursing services for all age groups. I'm particularly interested in the nursing services because nursing services is something that's pretty new in Ghana. Or I should say in third world countries as it is. Here in the United States, there's tons of nursing homes, and unfortunately, a lot of people, because they're working and we get to an age where you are like in your 40s, 50s, and then your parents are getting older. They don't have anyone to take care of the parents. They end up taking their parents to nursing homes. So the concept of nursing homes in the United States is very, very well known. But I didn't see too much of that when I was in Ghana. So tell me a little bit about how your nursing services are working in Ghana.
All right. Thank you. Yes, so as you mentioned, this is different from what is being practiced in the United States. So we do not have a nursing home, but we bring the nurse to your home.
Okay.
Yes. So we assign nurses to patients maybe after surgery. After surgery, if they need some assistance, feeding, with changing, with medication. If they have to change some NG tubes or they have to feed them through an NG tube, you need a nurse to assist you with that so that the guardian or the sibling or the daughter or son can go to work. So we have nurses stay with patients either within 12-hour period or 24-hour period to provide assisted health care till the patient recovers. And also for our bedridden patients, patient with stroke, they also need the nursing assistance. And so we have nurses assigned to these patients. Either they stay in or they go and come, and then they take care of the patient. They take good care of the patient. That's the difference between that of the United States. Yeah.
Excellent. And so that's okay. So that's more of like home care nursing services, which they have here as well. And it also works very, very well. But then I worry about the cost, right? Because here a
Yeah.
lot of insurance companies take care of a lot of stuff. There's certain benefits that we have with different insurance companies. So how affordable is this? Let's say that for our average Ghanaian person who maybe had a stroke and needs someone to be at home with him, like you said, to maybe perhaps help with an NG tube, changing, monitoring, making sure there's no skin breakdown. How affordable is this to the average Ghanaian?
Okay, so it depends on the service. It depends on the service. We have some patients that we go there just every 2 weeks to change an NG tube.
Okay.
And that just costs less than $5 because we've bought the NG tubes for them in large quantities. All we go there to do is to go and change.
Change it. Okay.
For those who have already signed on to ExpressMed, they do not even pay for that. Okay. However, if you have a nurse staying with you for like a month or 2 months, some as long as 6 months, then the cost is slightly high. It's not that it's expensive, just it ranges. It ranges depending on the patient's condition, but it's something that they're okay. And we have people in the diaspora who, because the concept is very familiar in the diaspora, they like it. Yeah, and so when they have their family down here, they prefer that they have a doctor and nurse go to the homes to look after them. And so we have most of our patients' relations outside the country, and then they monitor these, and then they give good recommendations about it.
I agree, and that's something that I was going to bring up. So this concept, and it's not only you, it's some of the other companies that we spoke to seem to be more familiar with the people who are here. So it's easier if you have a family member abroad to be able to send you money and understand how the concept works. So now I'm looking at the person who has nobody here, right? We're looking at our sweet aunties and our grandmothers and everything. How affordable is it for those people? And are they still able to get these kind of services? Because maybe they won't have that extra income coming in from the people who live in the diaspora.
Yes. Yeah. That's an important point. So we've segmented our various target markets.
Okay.
And then we provide tailored services for each of them. For our patients with no guardian in the diaspora, that's equally fine. They are grouped into 3. One is the youth, the second group is the working class, and the third group being the aged.
Okay.
Yeah. So for the youth, we realize that they prefer the digital services more. They like to talk about reproductive issues. They like to talk about problems with their menstruation cycles or some sexually reproductive, health issues. Okay. Mostly acute. And that's not expensive at all. With as little as 10, 20 cedis, maybe $2, they can get a good time with the doctor on phone or on video call to address their health issues. And then if there is a need for them to do labs or prescribe a medicine for them, we do that. Then we have those in the working class. We encourage the corporate wellness for them. Now, let's talk about the aged who are in Ghana without a guardian in the diaspora. Yes, that's where the issue is. So we spread it for them. So it's not something that, they pay at a go. We spread it for them, some on credit. Okay, but then we've reduced it because we frequent the places a lot. We've made them understand that it's not a cost that they incur every month. Because if a doctor visits you today for say $40 to $50, we monitor you for that whole period, maybe a month or 2 or 3, without you paying any extra cost.
Okay.
So it's not like an insurance where whether you fall sick or not, you've paid your premium. No. Once you pay for the visit. We do a lot of communication. So once we see you in person, then we do a lot of follow-ups through our digital platform. So you have the doctor calling you, you have the lab guys coming over, you have the nurses, you have medicines coming in, refilling, and all that. And so it is, they've not complained about cost yet. Yeah, that means it's not, it's not expensive.
Okay, that's wonderful, because that is the population that always really concerns me, right? Because we worry about everyone being able to have equal health care, accessibility to health care, which you spoke about earlier. And it's that unique population that sometimes falls underneath all these programs. So I'm very, very excited to know that you have thought about them. And you went ahead and told us about the people in the diaspora. So we know that the people in diaspora, of course, will help supplement and pay for these services, but how can people here also be able to access these services? Are we able to see our loved ones' records? Are we able to have consultations with the providers? Or how does that work for the people who are here and want to be involved in the healthcare of their loved one back home?
All right. I would say that our people in the diaspora make our work better.
Okay.
Because they ask a lot of questions. and we like it. But what we realize is that they want an interpersonal relationship. And so what we have established is that they know the doctor.
Okay.
And we have an electronic healthcare management platform where they get access to their patient file or folder. So they're able to monitor, they're able to read, they're able to review. And then we do a lot of communication on phone or on the platform. And so they are aware of the next visit. When we go, we take them through whatever the case is. We do a conference diagnosis with them. So they are with us, every step of the way. Just last week, one of our favorite patients, she just sent a picture of the mom. She thought there was something wrong with her. And then she said, I want this doctor to look at it for me. I said, that's fine. Then we had a doctor look at it. Then they just talk. And sometimes we don't even talk about health anymore. We just talk about, they're trying to come down to see their loved ones, but due to COVID, they're unable to come in. And so they're able to monitor the whole process.
Okay.
And then they make a lot of word of mouth recommendation. Yeah, they make a lot of word of mouth recommendation. That means it's something positive. And so it's easy for them as well. We talk to them all the time.
That's wonderful. Yeah. And a lot of comfort, because I think that's the biggest problem when you are trying to help someone in Ghana. And, being here, what you just said, that approach of how everyone is collaborating, healthcare is very, very important to people here, and people are responsible for their own health care. So there's a lot of consultation, there's a lot of family meetings. And so I found some places that you go in Ghana, they really don't want to take that time to explain. But as we've been speaking to more healthcare professionals in Ghana, we've realized that it's just the shortage of providers. And I do believe that if the doctors really had the chance to really have that one-on-one time with the family, they would want to. But the call of what they're doing there is massive. So we do understand, and we're hoping that things can get better. So with your program, and I'll ask this question and then we'll take a quick break so we can let people share the feed again, of course, and ask any questions. But tell me, what areas do you cover in Ghana? And also, are there any insurance companies that you work with that can cover this service for people?
Okay, so let's take the first part, which is what areas. Is it area in terms of service or area in terms of region?
Regions, please.
Okay, regions. We started in Accra, in Greater Accra, but we are gradually moving into other regions, because we've had calls and appointments from Central, Ashanti, and Eastern. We haven't been able to capture that market yet.
Okay.
But yes, but gradually we have started going into these areas, because we realize that Ghana is not just Accra. There are a lot of serious issues in other regions, and so it's something that we've started assigning providers to these regions, and we're also doing a lot of collaboration and partnerships with either private entities, other telehealth facilities, or even hospitals, to help us reach out to those in other regions who need our services.
Okay, excellent.
And the second thing about insurance, the second question was about insurance. So that's one of the challenges of the healthcare system. For some of the private insurance companies, they have explicitly stated that they do not cover for home care.
Okay.
And that's a challenge for the patient. You have more workers who are already signed on to a private insurance, who need to talk to a private doctor, who need a doctor come see them in the office or at home or on phone, but they will not be covered by insurance. So it's a conversation that is still ongoing. We've tried to have a few talks with them. I'm sure it's going to take a while, but we are hoping that we can bridge the gap between insurance and then healthcare.
Absolutely, and a very important gap to Brent. And it's the same thing here. I mean, there are a lot of stipulations with insurance here where they'll pay a number of a certain percentage, I should say, for home care versus someone seeing someone face to face. But for someone who does telemedicine themselves, and through COVID-19, telemedicine has really exposed a lot of deficiencies in healthcare. And I don't think it was only here in the United States. I think it was worldwide. So I'm very, very happy that you guys are on that board. We're going to take a quick break. Quick shout out to our sponsors: Ghana National Council, Omama TV, Holiday Africa, the Jemima NOONOO Foundation. We're going to take a break. Please make sure that you share this feed. This is very, very valuable information. When we come back, we're going to watch a short video. It's about 2 minutes, and it's actually going to be of Mr. Patrick giving us his experience with COVID-19 in Ghana. After that, we'll bring him back and we'll talk a little bit about it. Stay tuned. We'll be right back.
Internet is so much fun, I know. Corona is trending fast, I know. Some are scary, some are funny, others too fake news. Then don't share. Why not go to the right place for Corona news? Spreading lies can hurt. Share the facts, not those memes. You might save a life. Save a life? Yes, save a life. You can play your part. Children like us can also play their part by sharing only the facts? Yes, spread only the facts. Play your part too.
Be the one to spread only the facts from the Ghana Health Service. Play your part. In case of any emergency on COVID-19, call 112 or 311. This is brought to you by the Ministry of Health, Ghana Health Service, and UKAID.
Are you sick or have a health emergency and don't want to wait in long queues at a hospital, especially during these times of COVID-19? Worry no more. Dr. Now GH will bring the hospital to you. Now at your fingertips, you can see a doctor of your choice. Simply download the Dr. Now GH app from your phone's app store. Don't wait. Hurry now to sign up for free. Dr. Now GH, your doctor is now at your fingertips.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
I wasn't feeling too well. I was feeling feverish. So that morning, I decided to go and see a doctor. So when I went, the doctor asked me to do a malaria test. Then when the results came out, he said it wasn't looking good, so I should do a COVID test. So I went and I did a COVID test. Then the results came out positive. Well, initially I was disappointed because I was following all the protocols, as a health worker. I was trying to do all that I can to avoid this COVID thing, but I got it. So I was disappointed. Then I got scared at a point because at that point, due to the rate of increase and then the death and all that was going on, I was scared. I didn't know what was going to happen. The fever became intense. I was sweating profusely, especially for the initial 3-4 days. I could wear like 3-4 clothes and still sweat. But I was feeling cold inside. And then I was coughing. And then slight headache. It wasn't so intense, but I had headache. And then generally, I was tired. Full weakness. I couldn't sleep for 10 minutes. I just wanted to lie down before I realized I'm asleep, then I'm sweating, then all over again. The doctor gave me medicine after the result came out. So I started taking the medication. Then I added local remedy like steam inhalation alongside. But mostly I was home, so I did the self-isolation for about 2 weeks. COVID is real. It is real. I would advise that you follow the protocols, wear your face masks, sanitize your hands, wash your hands frequently with soap and then water, maintain social distance, avoid crowded places as much as you can. Also, importantly, try and boost your immune system. Eat healthy food, green leafy vegetables, exercise as often as you can to boost the system. Based on my experience, what I went through, I'll go in for it. I think I need the vaccine, and I think we do need a vaccine to help control the spread.
Wonderful.
Yeah.
So, that you went through COVID-19, and I think it is very important for healthcare workers for us to hear their story, because unfortunately, a lot of people did not believe that COVID-19 really existed. When you speak to a lot of people in Ghana, they say, "Oh no, here we're okay, things are fine." But we can see firsthand that even though you said you followed all protocols, you still ended up getting COVID-19. So thank you so much for sharing that story with us. And so I'll ask you, do you feel like COVID-19 has left Ghana's healthcare system more stressed out? Do you think it caused more stress to the healthcare system, healthcare workers?
To some extent, because when COVID hit, it was new. We didn't have a lot of information on it, and a lot of people depended on health workers.
Right.
This put a lot of pressure on health workers, one, to learn so that they can educate. People were calling you, what is this? What do we do? And you had to give them something or refer them to the right authority for the right information. We had healthcare workers now doing double shifts, extra hours, because of the numbers coming in and then the inadequate health workers. And so people had to go the extra mile, extra hours. And then came inadequate PPEs, face masks. And that was a lot of pressure on them. And then so it was a time that people also regarded the work of we, the healthcare workers, in the world, because almost everyone depended on them. And they had to be there for everyone. And that was a lot. It was a lot of work. And when some of them started getting infected. That was a big challenge. In some of the facilities, some of the health workers got infected. And so that reduced the number of people looking after those who got infected. And so it put a lot of pressure on the staff. And it's an experience that we do not want to go back to. Yeah.
Absolutely not. And that is why I really love that you are encouraging people to get vaccinated, use their mask, sanitize their hands. It is so important. And like you said, it's something that we don't want to go back to because it was very scary for everyone in the whole world. And it's a pandemic that we are hoping that will be closing very, very soon. So you talked about the healthcare workers and how they were. All of us here watched on TV how frightened healthcare workers were with lack of
Yeah.
PPE, not only in Ghana but all over the world. So would you say that the media in Ghana did a really good job on like educating people? Like here, when you wake up in the morning, every morning, sometimes you probably want to skip the news because it was always about the COVID statistics and
Oh,
everything. But how would you rate that in terms of Ghana? Were they doing the same thing? Was the media really educating people, letting us know where we were in terms of the COVID? How would you rate that?
yeah, yeah. The media did a good job
Okay.
in my assessment. We had some top media stations who were on COVID, providing us with the updates, with the regions, with the cases, providing us with feeds to ministers' press briefing, yes, information from the Ministry of Health. But unfortunately, information kept changing almost every day.
Mm.
Almost every day. Today we hear this is the cause, tomorrow it is this issue. And so if you do not follow through, you can misinterpret it. And so the media did a good job. They will go back and forth to correct it and also educate us. In terms of TV, in terms of radio, and then for those of us online, we also did our best to provide a lot of education and then updates to our audience. Yeah.
Right. So you said, okay, so you said TV and radio. So then what about those people, again, that special population that is always a big concern to us all, that don't have access to television, that don't have access to radio? Um, were there people in the marketplace, perhaps, educating people? Were there people on the streets? Were there newspapers? Were there flyers? Were there other avenues where people could get to know about the dangers of COVID-19 for those of them, excuse me, who didn't have access to television and radio?
This is an important question. This is very important. We experienced it. And so in one of the regions, we realized that one, they did not really believe in COVID.
Okay.
Because they hadn't recorded any case, and even if they did, it wasn't part of them. So we partnered with the Global Shippers Community, Cape Coast Hub.
Okay.
And so we went to a market in Cape Coast, Kotokraba Market, where we distributed free face masks. So we had somebody use the local fabric to design to print face masks, and so over 300, and we shared it to them. So in sharing, we now educated them. We now show them how to do the washing of hands, and we provided them with enough information to know that it is real. We also did same with the fisher folks who also didn't quite believe. I'm sure you saw some of the videos on TV. Yeah, they had a lot of misconceptions about it.
Yes.
And so for them, we had to do more of community outreach. And unfortunately, around that time, you couldn't do a lot of movement. Right. Movement was restricted, yeah. So we could only do targeted, awareness, like the taxi stations, the fishing community, the market areas. And so, yeah, that's how private and the government institutions, I think, collaborated to help fight COVID. Yeah.
Absolutely. And I love the fact that you said you went to the market, because to me that's very important. We saw very alarming videos that people share through WhatsApp. The most scariest thing comes through WhatsApp, right?
Yeah,
Where
I
people
know.
were in the market and nobody was wearing masks, and it was like, oh my goodness. So I'm happy that you guys were able to at least target one of the markets in Cape Coast and be able to share that information.
Yeah.
So we know that you got vaccinated because I saw it on Instagram. So tell me about the process for vaccinations, because some people are saying that vaccines are only available to a certain amount of people, and a lot of people are not getting it. So tell me how easy or how difficult it was for you to get vaccinated.
Okay, so we'll start this from the global point of view.
Okay.
Globally, inadequate vaccines, so they had to rationalize it.
Okay.
And so it was similar in Ghana. So they had to prioritize health workers, aged, those with underlying conditions in that order. Okay. Being a health worker, it was easy, I would say.
Okay.
because we were part of the first or second group. So they gave us a date, they gave us a center. You go, you submit your ID card, you take your shot, they record, then they give you a date for the second jab.
Okay.
Okay. But then they extended it. And so they opened up a lot of spots or centers to take your vaccines to most part of the general public, where you can go submit your national ID and take your shot. And so for those who were able to go to these centers in their local communities, they were able to get vaccinated. The first vaccination, I think it wasn't much of a problem.
Okay.
Yeah. However, there was a delay in the second jab because of the case in India.
Yes.
Which affected the global supply. And so by the time the vaccines were ready, people now thought that they had to, rush and get it. But some got it. So I believe that those who couldn't get vaccinated, there will be a time the government is sourcing vaccines. Yeah, and I'm sure that they should get it soon.
So would you say, and Dr. OFORI will probably join us a little bit later, he has probably more the accurate numbers, but would you say just from your own experience, many of the people in Ghana received the vaccination, or would you say it's still less than half of the population?
If I remember correctly, I think that we're looking around 20 million.
Okay.
And so there is a plan. But generally, our fight against COVID has been generally good, looking at our cases and our numbers.
Okay.
And so the government, in its own wisdom, has an approach that it is using to distribute the vaccines, which seem to be working.
I see.
Yeah, and so even though we still have a lot of people who haven't been vaccinated, the government has a timeline where it hopes to vaccinate as many as it can within that period. And so I believe that the health authorities are working on that. That's an area that we do not have much control over.
Of course.
Yeah, so ours is to encourage people to take their vaccine once it's available.
Of course. And interesting that you said that, because again, it brings us to that very special population. So we know that in the regions and in the bigger cities and stuff, there are facilities. We saw the list that they put out on Instagram and everything about where people could go. But then again, and knowing very well, I worry about my little place in Anamabu, right? So where are all those people able to get the vaccine, or were certain vaccines distributed to maybe the Anamabu Health Center or Nkwazi, all these places that are underprivileged? How were they able to get their vaccines?
So, looking at the cases, you can tell from the map or from the analysis that certain regions recorded more cases than some regions.
Correct.
And so the regions that recorded more cases were kind of prioritized.
Okay.
Yeah. And as interesting as it may sound, the local rural communities didn't get infected that much.
Oh, okay.
Yeah.
From the home remedies.
Yes. Yes, as they would put it. And so they were kind of second in line.
Okay.
And so, however, vaccine centers were still opened in these regions.
Oh, they were. Okay.
In Anamabo and in other rural communities. Yeah, but they started with those in the aged bracket, 60 and above, those with underlying health conditions, and they are continuing in that order. So it might not be enough to cover everyone, but they still manage to supply other vaccines.
I see. And I think that's a very important concept, because the people in the rural areas, how many of them would even report symptoms of COVID, right? Because COVID-19 has symptoms that could be anything. It could be a GI infection. It could be malaria. It mimics so many things. So how many people are really going to go and get tested and now be confirmed that they have COVID before they can now, plot it on the map? So I do understand that concept very, very well. So let us just take a quick break. When we come back, hopefully Dr. OFORI will be able to join us. If not, we'll continue on with our conversation. We'll talk about healthcare in general in Ghana. I'd like to encourage everyone to visit your Facebook page, which is ExpressMed Healthcare. Also, you can follow him on Instagram, which is ExpressMedGH, I believe.
Yeah,
Okay.
correct.
And then the website also has been displayed over there. And remember, guys, this is a wonderful, wonderful program, especially for us in the diaspora. Last week, we spoke at length with Mr. Sam, and he spoke to us about insurance and, security and making sure that we're taking care of our families back home. So again, this is another avenue that we can all use so we can be able to have that ease. Nobody wants to get phone calls in the middle of the night about your family not doing well. So you can trust and believe that with ExpressMed taking care of your family, you'll have that confidence. You'll have those consultation calls where you'll be able to communicate with your family members and the physicians back home. So let's take a quick break and we'll be right back. Stay tuned.
Hi, my name is Eunice Cromwell, the rap doctor, and I have something to tell you. When you need a doctor, you mustn't go anywhere. All you have to do is to call mobile doctor. They will send a doctor to your home, send a flap to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD and they will give you an amazing discount. Mobile doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net. Mobile doctors, the doctors in your home.
Are you sick or have a health emergency and don't want to wait in long queues at a hospital, especially during these times of COVID-19? Worry no more. Dr. Now GH will bring the hospital to you. Now at your fingertips, you can see a doctor of your choice. Simply download the Dr. Now GH app from your phone's app store. Don't wait. Hurry now to sign up for free. Dr. Now GH, your doctor is now at your fingertips.
Welcome to sankofaonline.com. Your #1 diaspora news portal has joined with GhanaWeb.com to bring to you the latest news around the world, especially Ghana. Visit our website at www.sankofaonline.com, or you can download our app from the Google Play Store or App Store. Sankofa Online, serving the Ghanaian Chicago community.
Biaba, maka maka. Entertainment and sports, maka maka. I say politics, maka maka. Royal Black says, Assembly Safwa, Bia Assembly Puno, Sanepi Adekami, Ekome Yakotokumi, Ekome Yamisebe, you want love make a hanging, maka maka. Royal Black says, Biaba, maka maka. All the trending issues, maka maka. I say politics, maka maka. Entertainment and sports, maka maka. RBJ Diaba, where you full from crowd. Asami Safwa, yeah, Asami Puno. Sasemnaba, yeah, Becca. Sanya Bettino, Sapepe na Yebekano. Maka maka, akesane kwedewo. Wabaye no ni wona je no na ke.
My name is Eunice Cromwell and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for joining us virtually for another episode of the Health Talks. Unfortunately, Dr. OFORI will not be able to join us today, so we'll keep all of our COVID questions pertaining to the vaccine for him to give us the answers next week. But I will have information about free vaccination sites later on in our program during the announcement section. So we're going to continue on with our guest all the way coming from Ghana, Mr. Patrick ANNAN-NOONOO, who has been giving us a lot of insight about his medical platform, which is a digital platform, ExpressMed. And we've been learning a lot about him and his platform. So we're going to just go ahead in general and just talk about healthcare in Ghana. One thing that's very important to me is that I love the fact that health is our wealth, but it's not really wealth if people can't afford it, right? So I'll ask the question that I've asked all my viewers all month, because June, we've just really dedicated June to really dissecting and understanding the healthcare system in Ghana. So do you think healthcare in Ghana is accessible and affordable? Why or why not?
Let's start with affordability.
Okay.
Yes. Although the national health insurance system has helped to alleviate costs, it charges a little between $1 to $2 or 12 cedis for a consultation. And then it also covers a list of services. However, that hasn't been enough to cover most of the services. And so it is affordable to some extent. But generally, it is expensive to access healthcare. So there is a hospital or there is a private specialist that you can see. However, can you see that doctor at the time where you need it? We have people booking for cases, but then the appointment date is in 3 months, 4 months, 6 months time. So even though you can say that, yes, there is neuro, I can actually see the neuro in 6 months. And for me, that isn't enough accessibility. Okay. So accessibility will mean that we have an expanded healthcare facility. We have a lot of infrastructure. We have enough medical facilities. There are issues where there are shortages of defibrillators. That's not accessible enough. And so we still have some key issues or some key areas that are still not easily accessible.
Okay.
Yes, and so generally, we still have a long way to go. We still need to expand our infrastructure, need to invest in a lot of services, a lot of equipment, a lot of technology, and also we need to engage ourselves in a lot of proactive diagnosis, and that can help us increase accessibility. Universal health coverage is geared towards increasing accessibility and also making it affordable. Private insurance is trying, cash and carry system still exists, and so we need a lot of collaboration, among the public and then the private hospitals and then the healthcare providers to make healthcare really accessible to everyone, especially the underprivileged or those in the rural communities.
Absolutely. So accessible to a certain level, affordable to those who would be considered probably in the working class, correct? Because
Yes.
You talked about the insurance, and we've asked about maybe 3 or 4 people who come on the show. Mr. Benjamin was nice enough to send us kind of the breakdown of the insurance. So okay. You said about 12 Ghana cedis. So we've also learned that the insurance company is not also paying on time to some of these facilities, which makes it a little bit more difficult. So would you say that people who have that insurance are still at a disadvantage? Because I for one, would love to promote the insurance because it's government insurance, right?
Yeah.
So thinking about the whole structure in Ghana, it would be wonderful if the Ghana health insurance was something that everyone could bank on and everyone could really depend on, and then use these other insurance companies as supplemental. But we've come to learn from talking to different people that that's not the case. What is your assessment on it?
I hope my managers are not watching right now. But that's okay. There is a lot of burden on the national health insurance system.
Okay.
Generally speaking, yes. Because I work with them kind of directly, so I know some of the challenges that they also go through.
Okay.
Payment is not on time, but in the contract they've stipulated that there's a 3 months gap to be paid.
Okay.
So it's not like when you submit a claim today, you are paid the following month. No. It goes through a process, thorough vetting, fulfillment, rejections, and all that. However, after the 3 months, then they can make adjustments and pay if necessary. But as we may know, it is not as we do not get it as we want it. And so sometimes there are backlogs, there are arrears. What I've seen over the years is that they go back to pay these backlogs.
I see.
Unfortunately, if your facility is dependent so much on the health, on the national health, and then you've provided services that hasn't been paid, you tend to run out of cash or resources to reinvest into provision of quality healthcare. And that's where we need to create the balance. And so the national health insurance system is good. We encourage as many people who can to sign on. But we also entreat the health authorities to also pay on time, so to support these providers to continue to expand and provide quality service. And that's something that we need to work on, going forward.
Absolutely. And I think that's fair. As much as we are encouraging all Ghanaians to join it, we are also asking the healthcare system to perhaps, pay more on time so that providers will be able to give this quality health insurance, which is evidence-based. But you can't do that if you don't have the money.
Yeah.
So I already know that your company is a big advocate for preventative medicine, which is something that we are strong believers here of and on Health Talks. So tell me a little bit about the challenges that you've experienced with your home medicine telehealth platform, because it is somewhat new in Ghana. Even though I did do some research, and I heard that telemedicine is not extremely new in Ghana, but I feel like with COVID, telemedicine has just projected. I mean, it's boomed all over the world. So it's still pretty new, relatively new.
Yeah.
So what challenges have you experienced even building up ExpressMed?
Before COVID was pretty tough for telehealth providers, because the concept, as you rightly said, they know of the concept, but using it was another thing. And so we didn't have a lot of people. Yes, this is good. This is something I would like to try, but they never really got to try it.
Okay.
Until they were in need, like desperate need. Okay. But with COVID, yes, they now saw that this is not harmful. This is here to help all of us. And so people started using it. Okay. And so telehealth is growing. It's growing. We want to get to a level where we can, we are going into proper precision diagnosis, where we have doctors collaborate, do critical thinking, integrate, and provide the right healthcare to the right patient at the right time.
Absolutely.
And that involves a lot of technology, involves a lot of innovation. I saw cancer company, I think it's in the US. They produce a thermometer that helps to predict the likelihood of you falling sick or getting an infection or a virus or fever or even COVID, ahead of time by just checking your temperature. And that is where we are going with healthcare, where there is a social materiality connecting everything around us to technology in a way that we can make informed decisions to improve our healthcare. And that level, we are not there yet, but that's where we envisage going to. And so these are some of the challenges. One, getting people to accept and then see the value, but maybe that also falls on us to continue to drive the message of value, what value they get from using telehealth, monitoring, security, privacy, convenience. These are the kind of benefit that are lowering lower cost of service. These are the messages that we need to drive. We need to send to people out there to use telehealth. Then there is also cost. We cannot do away with cost.
Right.
When it comes to healthcare, building an app that is secured,
yes,
to enhance doctor-patient interaction, securing folders, money, it comes at a cost. Data storage is one hindrance that we face. So having a data center that can really hold up information and then you analyze it, and so these are the areas and the challenges that we need to look at in telehealth. In terms of home care, there is also the challenge of getting enough healthcare providers, so doctors.
Right.
Assigned to patients. So when there is an increase in demand, you realize we need to get a lot of doctors coming in, and then all our doctors are specialists, family medicine. They are professionals. They have experience, and those are kind of difficult to get easily.
Right.
And so those are the few challenges that I believe most of the telehealth and home care facilities providers go through.
Absolutely. And there's such a need to it, because when you look at the healthcare system in Ghana and the lack of physicians, just because of the nature of the country, there's so many people there. You rightly said in the beginning that this was something to supplement, and it was something to aid and to make a difference. So with your company, how do you see ExpressMed really making a difference in the healthcare system in Ghana? Within the next 5 years, where do you see your company, and how are you going to go about making that huge impact, that huge dent in the healthcare challenges in Ghana?
Thank you. This is an important area. One message that we are driving is convenience. We want to make healthcare as convenient as possible for everyone. We want people to be more confident, comfortable, and happy about their health, just because they get the right healthcare. What we are driving the next 5 years is to have a population who are healthy, living a healthy lifestyle. You see, so for each of our patients, we've actually prescribed a diet plan for them that we monitor. Everyone has a diet plan. Then we recommend exercise routines. These are the areas, but we want to get to the level where healthcare will be very accessible using technology, and that's what we are working on. So in the next 5 years, I'm sure we can have another conversation to this time around assess the platform that we've created that is providing easy access to healthcare at a lower cost, and then also building a personal relationship with the doctors and then the healthcare providers. And so these are the messages that we are driving out there: convenience, healthy lifestyle, prevention. We are about to do a lot of projects in that space. Yeah.
Very good. And preventative medicine is really where it's at. So another question I was going to ask you was in terms of medications, because we know that a lot of times when you see a provider, depending on what illness you've been diagnosed with, you need treatments. So are you working with some different pharmacies? I know one day I called you in a hurry looking for some medications, and you said, "Oh, hold on." So tell me about the pharmacies that you're working with and how convenient. I read on your website that people can get their medications within 2 hours, thereabouts. So what pharmacies are you working with, and what partnerships have you built with these pharmacies so they can get patients their medications?
Okay. So we have established informal, formal partnerships with some renowned or trusted pharmacies, like Art Pharmacy, yes, and a few others. What we do with this is that it helps us to get a competitive pricing and also beat down price for the patient. We realize that there are so many pharmacies springing up. While this is good, you also foresee an influx in prices. And this is making cost of medicine also expensive. We keep talking about, a higher cost of healthcare, and we leave out medicine. I think medicine in Ghana is sometimes expensive.
Okay.
Yes. For a medicine that you can get in one pharmacy for $2 or 10 cedis, You go to the next pharmacy and the price is times 4, times 5.
Oh, wow.
Yes. And patients do not know this because you are sick at that moment and then you have to buy it. So what we do is to collaborate with a number of pharmacies to get an average price, and the quality to help reduce cost for the patient. And these are some of the benefits that comes with, working with ExpressMed. And so and some of the medications to branded medications.
Okay.
So you need a specific kind of medication. Sometimes it can be difficult to get. We've had patients in the diaspora call to say that they want maybe Xarelto or this particular medication for their patients, but the nurses are not getting that particular one. So where can they get that? And sometimes you have to go through a lot of stress to get it for them. And so these are some of the challenges with the pharmacies, but it's not a challenge for us because we have a number of them that we work with. I think the last time I sent you a lot of prizes to compare.
Did. And can I tell you that, speaking of Xarelto, that was one medication that I happened to be looking for a patient, and it was extremely, extremely expensive. And I do remember the hassle. I stayed up all night looking for Xarelto.
I know, right?
And it was very expensive. I really concur with that. Wow. So do you guys make referrals? So let's say a patient needs a referral to a specialist. Are you guys able to make those referrals? And if you are you working with physicians already that can accept those people's referrals?
Yes, rightly so. It's not just referrals.
Okay.
We collaborate with patients' former doctors in the hospitals.
Okay.
So when we visit a patient, we take the history, and sometimes we have to discuss some of the issues with their either current or former physician.
Okay.
Yes, and so we do not do anything in isolation. And so if there is the need for us to refer the patient to a hospital, we provide assisted services as well, because not all the services can be provided at home. Say x-ray, chest x-ray. We need to now go to a hospital to do the x-ray. And so we offer that assisted service, that referral to the hospital. And so referral, we do it seamlessly. We take a lot of feedback. And then we have other facilities also refer a patient for a home care.
Okay.
Yes, and so it's a two-way affair, referral from us to hospitals and then also from hospital. So at the end of the day, we collaborate to ensure an improved healthcare for the patient.
Absolutely. And that's very, very important that everyone works together to make sure that all the services are being able to be provided for. Tell me a little bit about the pediatric services, because children are a special breed, right? And it's very, very important to make sure that you have people who are experienced working with children. So do you guys have pediatricians on board? Is this a safe plan to call if somebody was having problems with their children? Would you guys be able to help them?
Yes, so pediatrician is a new service that we want to add on.
Okay.
It's a new service we want to add on, because we have some of our doctors specializing in pediatrics.
Good.
Yes, and so once that is done, that's an area that, because this is based on need from patients who call in and then ask for pediatric services. And so we decided to specialize in that area as well, get the right professional to offer pediatric services. So in a few months, we should add that to our service, and then we can have a pediatrician go see children and offer them the best healthcare that they need as well. And I think this will help parents as well, because sometimes it disrupts your busy schedule, because you have to go spend the whole time, and children are so dear to us, you cannot leave them. So you have to go with them and spend the whole time with them. But if you have the doctor come home, whilst the doctor is attending to your child, you can also get time to do other things while still monitoring your child's healthcare. And so this is an area that we are going into.
I agree 100%. Pediatrics is something that is very special to me. I did family medicine, so
That's great.
I take care of
Yeah,
everyone. But whenever I have children as patients, I'm very, very cautious, right? Because you want to make sure that they are growing appropriately, making sure they're having their immunizations, making sure they have the best chance of avoiding any type of infection. So I'm very, very compassionate about the children. I love the kids. So I'm
yeah.
happy that you're going to be bringing pediatricians on board.
Yeah,
Very, very, very.
you have in-depth knowledge in healthcare, and I love that about you. I mean, you have a
Thank
lot
you.
of information. You have a lot of knowledge. You should share. You should share. You should share. You
Thank
should just
you.
share with
Thank you
us.
so much. And that's all we're trying to do on our platform. Speaking of
Mhm.
sharing, let's go to our viewers and see if anyone has given us any comments. We don't want to leave them out. Also,
Okay.
remember that you are able to, if you'd like to, you can always call us.
Hello there. Welcome to Trend Africa, where we give you the best of live streaming across all states in the US. We also do web designing, event planning, MCing, app creating, and promotions. Or if you want to shoot an advert for your business or a show, you can contact us on +1773 312 0318. For more information, you can visit our website at www.trendafricaonline.net and also on our social media platforms at Trend Africa TV. You can download our app Trend Africa Online on the Google Play Store and App Store. Trend Africa, redefining Africa.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Sorry about that. Technology is only as good as it is when it works. Sorry about that. I got disconnected. Let's go to our feed and see what we have here. So one moment, let me pull it up. And we have a message from our producer, who is Royal Black Jesus. He says, your comments are welcome. Share, share, share. Very informative information. Thank you very, very much for that. Akwesi Nimo says, great show. Thank you so much for joining us today. Mr. Kofi Cromwell, my very, very special husband, says, this is a great service to help our people back home. Thank you, Fee. We really appreciate it. And then Benjamin, who joined us 2 weeks ago, says, you guys are doing a very good job. Proud of you. We are also proud of you, too, for all the work that you do back home, Benjamin. Thank you. Thank you, thank you, thank you. We're going to go ahead and take a few announcements. It's 8:07. Also, I just wanted to let people know that if you wanted to call in, you can call in via WhatsApp, and that phone number is 773-312-0318. And that way you can give your contributions. You can ask questions or anything, and that's direct. So you can just call us via WhatsApp. Okay, so 773-312-0318. Okay, and let us take a few announcements from the community. First and foremost, Ghana National Council, of course, is very, very committed to everything that's going on with COVID-19. We canceled our Ghana Fest last year to make sure that everybody was going to be safe. This year, we will be having a community picnic. It is not going to be Ghana Fest because we still truly believe that we need our community to be vaccinated so that we can safely be outside together in that mass amount of people that normally come. Anyone who comes to Ghana Fest know that we're about 5,000 to 10,000 people in the park. And the health administration of Ghana National Council, along with the executives and the elders and the president, really feels that it would be safer if we wait to have that magnitude of people till next year. But we will be having a wonderful picnic, which will be coming off on July 31st. The date will be announced in a couple of weeks. We're just working on a few things, but it will be from 11 a.m. to 8 p.m. We will have some live music. People are free to bring your lawn chairs. Just enjoy the day. You'll get to see people that you haven't seen for a long time because we've all been inside because of COVID-19. So save the dates and make sure that you are there. It will be streaming live. You know, we'll have Trend Africa TV there with us. And so you should expect to see this on Facebook, Instagram, and YouTube. So once again, July 31st, 11 a.m. to 8 p.m. And the date will be shared, and that's brought to us from the Ghana National Council. Also, Ghana National Council always likes to congratulate all of our graduates. We know that we've had a lot of people who have graduated, so we say congratulations to you. Even through COVID-19, you were able to finish your education, so we are very, very proud of you. Make sure you send your picture of your graduate along with the school they went to. We'd like to put something special together for them, which will be displayed during our picnic time. So deadline for that is going to be July 17th, I believe. You can send it through any of our social media pages, Instagram or Facebook. Also, feel free to email it to me directly, Eunice Cromwell at hotmail.com. You can also have any of your affiliate members send it to the Ghana National Council WhatsApp page, and we'll be able to accommodate that. Lastly, we are going to be having a free immunization for COVID-19. That's going to be brought to us from the African Methodist United Church. Very, very good initiative they are doing. They have a number of nurses there. In fact, the Ghana Queen Mother is a nurse, and also the Fanti Queen Mother is a nurse. And they have come together along with the Girls for Girls, which is Mrs. Diana Amu. And they're going to be giving free COVID-19 vaccinations. That is going to be happening on Sunday, June 27th from 12 to 4 p.m. That's African Community Methodist Church. That's at 4047 North Keeler Avenue. So if you have not got your vaccination, you can come there. Remember that vaccines are now offered to children that are 12 and above. CDC has not given us any indication of when they're going to have vaccines for younger people. I know they are still doing trials, so let us be patient. But for now, 12 and above, you can go to the African Community Methodist Church, United Methodist Church, 4047 North Keeler, and you just go there and they'll give you your vaccination. And as Ghana National Council has always been bringing you updated information about COVID-19, we would really like the community to take advantage of this wonderful opportunity and get vaccinated. We'll take a short break and we'll be right back to continue our conversation with Mr. Patrick. Stay tuned.
The Post-G Mix class is something the industry needs, because I have been part of so many conversations where the argument has been that songs coming from outside Ghana, let me not even go far, especially our Nigerian counterparts. So many people feel that their songs are well produced, well mixed and mastered than the songs we produce here in Ghana. I've had countless conversations with Post-G himself. So when I heard that he's doing the Post-G Mix class, I said, okay, every producer needs this. So growing up, I was told that knowledge is wealth. So whatever you do, seek knowledge. My name is Sammy Flex. I work with Xylophone FM 102.1, and also I operate an online channel, Sammy Flex TV. I endorse Post-G's Mix class. Everyone should be part of this.
I don't Ghana for Chichi Amuna. Say ya dish ya nuaba Paulina. And for my Breton tin, you did two when him say, I will say your boy, your son, ya dear. A quenya na bedru, you create GoFundMe at your mano. Your bank account and your mobile money number. I do resistica a dear savino. The best ubi bia we here GoFundMe account a link no. Video yase link no eda ho obenya link no mobile money no ewo ho na the bank account so ho yenya $50,000 eda na ko India akwa in operation ti mesre menuanom Ghana fo nyina yamfa wodo yamfa ba akoye na yamfa nsa Paulina yare na enhye ye ni nyina enemunyam ti number no so ena that screen so no ene the bank account no ketwa bi enso yamwa na abaiwe ehonto no Yadamu Nasi. Bye-bye.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for staying tuned with us. We really appreciate you. Make sure that you always stay tuned with us every Thursday for the Health Talks. If there's a specific topic that you're looking to get more information to, make sure that you can send us that information so that we can find that specialist to bring that information to you. We're going to continue our conversation with Mr. Patrick. So tell us, how do you go about booking an appointment? I know we spoke about the short code and the app, but tell us, how do we, let's say we needed someone to have an appointment. What do we do?
Okay. You can first visit our website, www.expressmedgh.com. When you are on the site, you see a button, book an appointment. It's everywhere on the website. You click on it, and then you just key in just a few details, name, contact, number, and then we will contact you.
Okay.
From there. Then we take it from there. So that's one, so that we can also keep track of the appointments that come in.
Okay.
For those on social media, they always send us DMs. They on Instagram or Facebook. If they have some minor issues, they always send us a DM.
Okay.
But you can always reach us through email as well, expressmedgh@gmail.com.
Okay.
And then most people also do call. I don't know if we have to give our phone number out there, but most people call us as well. 0542 05 3335. Yeah, so the website, phone call, social media, we are easily accessible. You can always reach us. Yeah.
Sounds good. And then for the short code, what do you dial for the short code?
So that is *714*33#.
Okay.
Yeah.
So that means if you don't have a smartphone and you're in Ghana, you can dial *714*33#.
Yes.
And you'll be able to get connected directly to you.
Yes.
Okay, wonderful. And then how long does it take to see a doctor? So let's say you do this process, they DM'd you or they've emailed you, called you, short code you. When can we expect to hear from a doctor?
Okay. For those who want home care service, when you book an appointment, we have our administrator talk to you to take a little information on the patient so that we can have a little understanding of the situation, and the doctor to assign to the patient together with the labs and the nurses that will come with it. Okay. And we have that discussion with you between 24 hours to the next 3-4 days. When would you prefer? When would be convenient for you? Would you like to have a guardian there when we go? We usually prefer to have a guardian also around to kind of monitor, or if we like to talk to you as well. So within 24 hours to 3 days, we should visit you at home. For those who want digital consultation, want to talk to a doctor on phone, that's within 24 hours.
Within 24 hours, okay.
Yeah, that's you call, we just connect you, you talk to. And some also want lab service. For some of the labs, you might not have to take breakfast. So if you call today in the evening and we need to do it when you've not eaten, we might as well do it tomorrow.
Tomorrow morning, okay. For any fasting labs.
Yeah. Yes.
Okay.
Before it passes. And then for the companies usually takes a lot of back and forth. Those who want the corporate wellness program, because it's a long-term program, we do a lot of survey, with the staff. We do a survey to assess the healthcare situation in the company. Then we do a sensitization or a health talk with the staff and management before we do one-on-one consultation, followed up with a medical screening of physical examination, cholesterol, kidney, diabetes, hypertension, and a host of services before a medical report follows. So sometimes we sign a company on for 3 months, 6 months to assess, to improve on the healthcare and productivity in that company.
I see. And you mentioned all these other elements that people may have: hypertension, high cholesterol, kidney problems. Is anybody, would anybody be disqualified for any pre-existing conditions, or are these things that you can be able to work on and still increase the health of the entire company?
No one is isolated from healthcare coverage.
Okay.
Yeah, so patients who have existing condition, like hypertension or that, which is very prevalent in the working class these days. People below 60 are getting it. We manage them. Okay. At that point, you cannot completely treat it, so we manage it. We manage it in a way that they see improvement. So we put them on a program, 3 months. Let's follow this diet plan. Let's follow this lifestyle direction. Let's try and reduce these things. Let's talk to the doctor every week or 2 weeks to see how we are faring. Then we do some adjustments. So, for example, we've seen patients who complain of inadequate sleep, and then difficulty to follow the diet plan because they are so used to probably eating a particular meat, and then they now have to change. Okay. That's okay. We still go in and then we fine-tune the program. Okay. And then we fine-tune the sleeping pattern, we fine-tune the TV. At a point we have to bring physiotherapists, psychologists, everything in there. So we have these specialists who always come in. And so no one is isolated from seeking healthcare. Whether you are sick or you do not want to be sick, we can provide quality healthcare for you.
That's wonderful. Very, very, very good. So people book their appointments, and I especially like the corporate wellness program because companies can really make sure that all their employees have this. Now, so with the corporate wellness program, do people pay individually, or is it something that the whole company pays on behalf of everybody?
So far, the company has been paying for the staff.
Okay.
And then for even the multinationals, we had the insurance company pay from outside Ghana.
Oh, okay.
Yes. So what we realize is that some insurance companies, especially the international ones, cover for some of these corporate wellness programs. And so they made it clear that these ones are covered. So you can provide these services, and then the rest they would have to find. Maybe the company would have to offset that bill. And so it's a collaboration between the insurance company and the company itself, so that we do not put burden on the staff.
I see. And you mentioned that labs can be done at home, and then if there's any maybe more specialty labs, they have to go to a laboratory or a hospital to get those done.
Yes, some of the labs you do not have to go to the hospital. We have a mobile laboratory.
Okay.
We have a mobile laboratory. Urine analysis. We do a lot of analysis. Kidney, lipid profile. Tomorrow, Friday, through to the weekend, we are doing a lot of mobile labs.
Okay.
And then we come analyze, and then the doctor. And some of these labs, we even run it with accredited laboratory centers like MDS. And so it is very accessible. Sometimes we contact these accredited lab facilities to come home and then take the lab test, and then we run it. Then we have the doctor look at it and advise you, all in the comfort, of your home. You do not have to go spend a lot of time anywhere.
Very, very important. I'm sure that this became very convenient and also a relaxation of the healthcare system through COVID. I mean, at one point here, they were saying that there were no hospitals, no hospital beds. They were advising people who even had symptoms of COVID to just stay home and self-isolate because it was so burdened. So I can just imagine what Ghana went through, trying to keep people from going to the hospital for, just minor things, whereas it was all booked because of COVID.
Yeah, it was a difficult period.
Yeah.
But for the peak, it was 2 weeks. People were advised to stay home.
Yeah.
Yeah, and one thing COVID has done has also, one of the consequences to the hospital facilities is that it has reduced attendance. Even after COVID, now attendance has gone down.
Really? Okay.
Yes. But we need a few months to now assess whether they are, is it that they are staying healthy at home, or there are issues that we should expect.
Yeah.
Yeah, because people were now scared. You know, some were scared to go to the hospital. Others were also advised to stay home and rather call the healthcare facility. And so most of these patients took advantage of ExpressMed. So they rather call and then talk to the doctor on phone, or have the doctor come home to attend to them. If they need to run some labs, you rather come and run it for me, since I do not want to come to the hospital.
Very, very true. And I have heard a lot of people say that it was rather at the hospital that they were getting COVID. that's what someone told me.
Yeah, during that time, no place was safe. So you just had to be careful. You just had to follow the protocols.
Well, we're so grateful that Ghana is on the road to recovery, as everywhere else is. We're going to go ahead and take a comment from Mr. Benjamin. He says, looking at the health system in Ghana, major decisions and policies, including distribution of infrastructures and logistics, are influenced by politics, thereby creating inequalities. Government mostly wants to impress the people in order to retain power at the end of the 4 years. How do we ensure that the negative political impact on the health system delivery, the services, is reduced to the barest minimum? Thank you for your question. And Mr. Patrick, that question goes to you. He wants to know, how can we ensure the negative impact of politics, the negative impacts on politics on the healthcare system delivery will not keep on going on, basically.
All right, that's a good question, Mr. Benjamin. Thank you. And this is an issue that I was hoping that we can discuss getting to the end of the show, but let's discuss it now. We need, in order to make healthcare better or improve the healthcare in Ghana, one of the things we need is for the system to work. And when we say the system should work, we are looking at policies, we are looking at the process, we are looking at the people, and by people we mean leadership. So those in authority, regardless of the government in power, healthcare shouldn't be difficult for me as an individual to access. And that requires policies that work. That requires affordable healthcare. That requires prioritizing the funds and channeling them equitably in the various healthcare infrastructures. Who monitors these? You know, who audits these processes? We saw videos of some people sitting on the floor in some major hospitals during a pregnancy. We cannot take this going forward. We need to invest in an infrastructure, and if there is funds, we need to invest it in the right places. And so policy is something that we need to always look at. Who is in charge of these policies? And these are questions that we ask ourselves daily. And so you realize that there's a lot of stakeholder collaboration going on these days between the government, the public, the quasi-government, and then the private sector. And so what Mr. Benjamin is saying is really true. But if we have a system that works, where policies are in place, the processes are there, and then we have the right people, right experts doing the right things, then we can have a better healthcare system.
Absolutely. Thank you, Mr. Benjamin, for that question. And thank you, Mr. Patrick, for that wonderful explanation. It's 8:28, and we are always committed to keeping our time here so that we can keep our viewers. So I'd like to give you this time to give your closing remarks. And let me just start by thanking you very, very much for spending this time with us all the way from Ghana. We know that it's late in Ghana, but we really appreciate you educating our viewers on your health system, all your knowledge. It's very, very well appreciated. So thank you very, very much for honoring our invitation and joining our program tonight. And the closing remarks, please.
Yeah, thanks for having me. Thanks to your organizers for such a wonderful initiative. I think you guys are doing a great job, and let's keep talking. Let's keep doing this to help improve healthcare in Ghana. In closing, I will also entreat a lot of partnerships and collaboration. You know, the government is calling on investors in several sectors: energy, agriculture, infrastructure, roads. some of these investments should also go to the healthcare. And so just as we have investors looking at other areas, they should also look at the healthcare sector. And that's why earlier in my profile, you mentioned that we facilitate companies from outside Ghana to also establish and grow in Africa. Yes, we've had a few companies contact us from the diaspora as well, still in talks. And so partnership is one thing that we need.
Looks like we're having just a small connection issue. We'll take a short break, allow him to refresh his screen and hear his closing remarks. Please stay tuned. We'll be right back.
Hi, my name is Eunice Cromwell, the rap doctor, and I have something to tell you. When you need a doctor, you mustn't go anywhere. All you have to do is to call mobile doctor. They will send a doctor to your home, send a flap to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMB and they'll give you an amazing discount. Mobile doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net.
This is the Ghana Agenda and my name is Alfred Amuzu. On the Ghana Agenda, we talk about political and financial related topics occurring in Ghana. We try to break down some of the most complicated issues and we make sure that all our listeners leave the show with something at the end of it. Again, tell your friend to tell a friend. Alfred Amuzu is on every Sunday on the Ghana Agenda.
My name is Eunice Cromwell and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you and sorry for that small hiccup. We'll go ahead and let him continue his closing remarks. Mr. Patrick? Mr. Patrick, are you with us? Unfortunately, I don't think he's able to hear us at this time. Well, we are very, very grateful that he was able to come and, you know, it's a different country, right? So we're doing our very, very best to make sure that we're bringing you accurate information from where we're talking about, right? So sometimes when we have our guests from Ghana, technology can sometimes be a little bit of an issue. But given the common problems with access to healthcare and the disparity in the distribution of healthcare centers, several African countries are looking towards mobile technology to bridge the gap. The process, broadly referred to as telemedicine, focuses on connecting health workers in small communities, usually lacking in health equipment and capacity, to experts in city health centers through mobile phone and in some cases the internet. While telemedicine is yet to gain traction broadly to the continent, some processes and some progression have been made in places like South Africa, Ethiopia, and Mali. But Ghana could really top that list. The country's health service and ministry have committed to scaling up telemedicine pilot projects, and many companies are also proven successful in healthcare delivery in Ghana, just as we heard today from the ExpressMed. We are very grateful for this program. We ask for you to continue to join us every Thursday as we bring you important topics. Until next time, I'm your host, Dr. Araba. God bless you and God bless our homeland, Ghana.